Welcome to Obstetrics and Gynecology Made Easy. In today's video, we will be exploring a key question in obstetric care. Why is labor induction typically initiated with prostaglandins rather than oxytocin? Induction of labor is typically initiated with prostaglandins rather than oxytocin for several key reasons. 1. Cervical ripening. Prostaglandins, such as dinoprostone, prostaglandins E2, or misoprostol, prostaglandins E1, are effective in softening and dilating the cervix, a process called cervical ripening. This is especially important if the cervix is not yet favorable for labor. Bishop score is low. Oxytocin primarily stimulates uterine contractions, but it does not have a significant effect on cervical ripening. 2. Better preparation for labor. By promoting cervical ripening, prostaglandins help prepare the cervix for labor, which can lead to a smoother and more effective induction process. Starting with oxytocin in an unripe cervix may increase the risk of prolonged labor or the need for a cesarean section. 3. Sequential use. In many cases, induction begins with prostaglandins to ripen the cervix. Once the cervix becomes more favorable, oxytocin can be introduced to stimulate stronger and more regular contractions if labor does not progress naturally. 4. Reduced risk of uterine hyperstimulation. Prostaglandins, when administered properly, tend to have a more controlled onset of action, allowing the body to gradually prepare for labor. Oxytocin, on the other hand, can sometimes lead to excessive uterine contractions, tachysystole, if not carefully monitored. Thus, prostaglandins are often used first to make the cervix more favorable, setting the stage for oxytocin if needed later to further induce labor.